Well, hello, hello, hello. I am Pastor Rhonda, founder of Celebrate Life Cancer Ministry, and your host for Celebrate Life Today. And today we are going to have a great conversation with some powerful women of the Los Angeles community. All of us are friends, and we've been working on a number of projects recently. And we said, hey, we always bring in the other speakers. Let's bring in ourselves. So here we are today to bring to you information about caregiving. So, I am, let me just introduce myself. I'm Pastor Rhonda, founder of Celebrate Life Cancer Ministry, a ministry that has been in existence for 19 years. And I am a 20-year inflammatory breast cancer survivor.
Mm.
And that is from the direction that I will be speaking with you today. And allow me to introduce my partners. And I will start with Dr. Sharon Cobb.
Okay.
Introduce yourself.
Um, yes. Hello, everyone. Thank you so much for the invitation, Pastor Rhonda. Again, my name is Dr. Sharon Cobb. I am currently the Director of Pre-Licensure Nursing Programs for Charles R. Drew University of Medicine and Science. Additionally, I also serve as a assistant professor and have had years of work in the area of cancer survivorship and caregiving primarily for African American and Latinx populations. So I am thrilled to be here today to speak on caregiving for our communities. Thank you so much.
But before we leave you, Dr. Sharon, you're also in the midst of another project today, right? Can you tell
Yes,
us about that?
yes, I am. So currently, as you can see, my coat, we are out here in the community today. I'm leading a current project that focuses on COVID-19 vaccine uptake, meaning to increase COVID-19 vaccination as well as testing for individuals living in public housing areas. Specifically, we've been working with the Housing Authority for the City of Los Angeles in order to host health resource fairs and to also train public housing residents to become COVID-19 leaders, activate leaders. So we've been working with various public housing sites, including Nickerson Gardens, Jordan Downs, Gonzague Village, and as well as Imperial Courts. So we are out there today in the community with a lot of our partners. Thank you.
Awesome. Thank you so much. And then we'll have Dr. Kathye Jenkins.
Oh, praise the Lord. I am the founding president of Cynthia Perry Ray Foundation, who has a health and wellness outreach called Witness to Fitness. As you see, it's a two, not a T, because somebody told me what WTF meant. And I, I said, no, that's not what we're saying. But anyway, we bring the news of health and wellness education primarily to the faith community, but we're open to provide it to anybody who can and will. It's not what we is what we don't know is killing us. And so we bring that each month. I work with these three ladies too on a regular basis, especially Dr. Cobb and Dr. Ashing each month on our sister nurse series that's at the end of the month. So look us up. Look us up. Cynthia Perry Ray Foundation, Witness to Fitness. Thank you, Dr. Rhonda. You know, she called me Dr. Rhonda, Pastor Rhonda.
Oh,
Thank
amen. Amen. And then we have Dr. Kimlin Ashing.
Good afternoon and good day, everyone. Thank you, Pastor Rhonda. This has been a journey of mine, starting with actually my parents having cancer. So I understand the perspective of being a child of parents who have cancer, being a caregiver, and also that has inspired me to focus on cancer research. So I'm a psycho-oncologist at the City of Hope Comprehensive Cancer Center. That means that we are one of the few NCI designated cancer centers within the United States that we provide superior cancer care, research, quality of life, and community engagement. So I am a professor there, as well as Associate Cancer Center Director for Community Outreach and Engagement, and have been working with Pastor Rhonda for almost 15 years now on serving our community And the focus is really on bringing activation, um, best care, access to research, including clinical studies, and quality of life for both our survivors as well as our caregivers.
Awesome, awesome. So, as we begin our conversation today, I want to kind of rest on the caregiver specifically. There may be spaces in there where we're talking about the cancer patient, and a lot of this information we're going to talk about. It really doesn't matter what the health challenge is, because we're really talking about the caregiver. What I would like our conversation to begin is, how does someone become a caregiver? Do you just wake up one day and find out, hey, I want to be one? Or how does that go?
Well, I'll start. I don't think any of us are really prepared, right? When my father was diagnosed, I was 12 years old. I didn't know the word cancer. No one in my family had been diagnosed previously. And so it really punctuated my life. And I felt a sense of vulnerability that I think maybe because I was 12 as well. But I think the from the perspective of a child, having older siblings and my mom and the family surrounding me, as well as given that my father had colorectal cancer, which meant he had a long-term survivorship, and he had pretty decent quality of care, that I recognize that it's a journey, and it's a journey not just for the patient. The patient may be the one receiving the actual treatment, but everyone in the family is affected by the cancer, and that caregiving and support goes beyond blood relatives, because a community of support and a network of support can include friends, it could include neighbors, it could include support groups, it could include a spiritual ministry, so that we ought to be open, especially for those cancer patients who may not have a partner or a spouse, or may not have children, that it's quite all right. And our community has a history of what we call fictive kin, meaning that our relationship and our ties go beyond blood, so that we can reach out, because people are there to help, and there are supportive networks and support groups that's also available to help. And it's something that it's a day by day process. Now we have caregiving and navigation training, but many of us who are caregivers are really just it just happens in our circle, in our network, and there's not always a preparedness. But programs such as these can give awareness to those who may be facing cancer, and giving them permission to reach beyond their family network to get the support that they need. And for those caregivers, recognizing that we also care about the caregivers as well.
Yeah.
Very good, very good. Anyone else want to chime in?
Well, like you said, it's not like you said, when I grow up, I want to be a caregiver. It's one of those things that it just happens. And some people are very quick and can adapt to change well, and some can't. That's why support is so important, and educating yourself on what it is that you signed up to do is very important. And the resources in places like Pastor Rhonda's Celebrate Life, to have access to those kind of resources. Because what happens is, a lot of times we try to do stuff on our own, and we really don't know what we're doing, but we mean well. We mean well. We love the person. We want to see them do well, but we really don't know what we're doing. and we get hurt in the process ourselves to where we might end up needing care ourselves because we didn't look into what needs to be done. So I know that we keep bringing up the education part of things, but education is so important to know what it is that you're doing and to get that help. Don't be afraid and don't be scared to ask for some help. We all need help. We do.
Awesome. Dr. Cobb, I saw you starting to say something.
Oh,
Oh, I didn't see her. I'm sorry.
no, no, no. Oh my gosh, no. It's okay. I think definitely everything Dr. Ashing and Dr. Jenkins said is very significant, especially for caregivers in all type of stages. I think in just relation to what you started to introduce, Pastor Rhonda, was that, you know, to become a caregiver can happen overnight. You know, it's that person who gets the diagnosis in that office that day that says you have cancer, and depending on what stage. And so then whoever that person who now has to emerge as the caregiver, whether that's known as a primary caregiver, a secondary caregiver, you may even be in another state and be a caregiver to someone, you know, such as financially or just emotionally. So it becomes a process overnight. And I think it goes back to what we've often saying is education. It's never too early to learn how to become an effective caregiver, how to balance that with being able to give your care for somebody as well as to care for your own self. So it's never too early because, you know, just to recognize in our life, there's usually some person that we may end up becoming a caregiver for. So I always think it's good to just start that preparation from now at this point.
Exactly. So, because we realize that a person can become a caregiver when they are anticipating that it's coming. They can be diagnosed or have an accident and it's instant.
Mhm.
And but then sometimes we can just look at our family dynamics and we can say, okay, well, this person is aging, or this person is ill and they have children, or this person has to take care of this and that, and what is my role in my family? And a lot of people these days are backing down and away from caring for family. I heard a patient tell me the other day, family network is not what it used to be. You know, you used to get sick and people would just come in from everywhere and trying to see what they could do to help. But life has changed. Technology has stepped in. You know, we're shipping groceries to the house rather than showing up. And in all reality, the person really needs to see us. You know, more times than none, the patient would love to see us more than us just sending over a service. But as situations occur, sometimes that's the only thing you can do. I'm in the midst of being a caregiver for a person right now, and I don't drive the freeway. So they literally were in West LA, which was a couple of little 45 minutes later, I'm there. But now they've been moved to Redlands.
Oh wow.
That's a 2 hour ride
Yeah.
for anybody. And that's an all day ride for me. Guess what? I'm not going. But I have managed to um, figure out what they like to eat, and I can send that. And then I can do what do they call the thing? Duo or a FaceTime. And so while they're having the meal that I sent, I can be on the phone talking to them while they're having dinner. So it's the closest I could get. But you know, different situations will bring about different things. So the next thing I want to talk about is is there a difference between caring for someone who is just sick or someone who is in hospice? Is there a difference, or does it all look the same?
I I would say as a caregiver sometimes there is a difference. One of the things, it reflects back to what you just said, is that you may be a caregiver for someone who's aging, or and so that dynamic is different. You're helping that person probably do the regular activities of daily living, such as helping to prepare meals, helping to prepare the medications for that week, maybe helping with dressing. But a person changes when that person is in hospice. Now I have to consider that now there's no longer the routine medications that person is on. Now a focus has shifted to become more on comfort and care. So now as a caregiver, I have to start readying myself and readying my mind that at any time this person may leave or may be gone. And now I have to think, what's the directives? What are the things that I have to prepare for? And now I have to start thinking also, what do I do at the end of life after that person has passed? How do I start preparing myself? So there's a lot of preparation that goes in when that caregiver is now caring for someone who's now in the hospice or at that end of life stage. And so it's important that also as a caregiver, you start to recognize some of the stressors, some of the anxiety, and also be able to assess your own wellness with having someone, because caring for someone who's in that end of life stage can be difficult for the caregiver, because not only are they worrying or having anxiety about their loved one, that care recipient, but they may also be facing their own stressors on their life as well. So this is important, where I say there's a balance, because now different priorities shift once that person has entered for hospice.
Right.
And in addition to that, when we say caregiving, giving, a lot of times we think about the physical aspects of like cleaning up somebody or feeding them, uh, manually feeding them ourselves, and that's not particularly all the duties of a caregiver. Sometimes it's just to make sure that that person takes the medicine on time, to make sure that things that routinely go on stay on point. But when somebody's on hospice, you already know that death is coming. And if you're dealing with a family situation too, where now they know this person is passing, you got all these emotions coming in. You have drama sometimes because some people can't handle that this person is going to pass, especially if they didn't treat them right. I'm going to put that in there, especially if they didn't treat them right. So you got to deal with all that guilt. And all you're trying to do is help this person go transition, and the other ones are not recognizing it's not about you and your feelings right now. It's about helping this person that's getting ready to leave here and transition from one place to another. So I think that's one of the biggest thing differences I can see is that one, the other person, when you're being taken care of, sometimes you mentally and physically can communicate and do, but when you're on your way out and you on those meds, especially that what they give you, morphine and different other things like that, a lot of time you're not in your right mind. So you're totally dependent on somebody to do something, but it should be at your, what's best for the person.
Yeah, I just wanted to add to Dr. Jenkins and Cobb is that when the person is in hospice, the caregiver's role, I think, is quite different in the sense that they are um, focused on the transition, as Dr. Jenkins said, that they are the caregiver now is, planning for um, the service, planning for funeral, planning for has this been paid for, their financial costs associated with that. Um, there may be feelings of guilt, at that point, have I done enough? What can I do more? There may be feeling of remorse, of this sense of impending loss. So I think there's such complexity at that point, and then there's also the stress of sort of doing much of the physical, taking care of the person, the feeding, cleaning. That is very different if the person is just ill and may be able to do some of these functional things for themselves. So I think the role is very different, and as Dr. Jenkins also mentioned, usually with palliative and end of life care, there's a lot of medication, pain medication. The person may not be aware, so then the caregiver is doing so much caregiving, but yet not feeling that sense of appreciation because the person that they're caring for may be very out of it. And so there's a lot of emotions going on. I mean, caregiving always involve a lot of emotion, but I think at that particular time it gets very, very complex. And you know it adds an additional sort of emotional demand on the caregiver, and may be important for the caregiver to reach out even more so for support during that time, and not feel that they have to bear all of this on their own.
Thank you so much. So when we talk about reaching out, um, it's not always that we can reach out to our family. But if we, as we reach out, I think that there's some tools or some things that we can think about that would make reaching out a little easier, because we tend to put everything in the same basket. And like, if somebody can't come help and do everything, then I don't need them. So, but when we think about it, there might be someone who really likes to do grocery shopping. There might be someone who loves to make phone calls. So what kinds of tips and things or roles, various types of roles, can a caregiver look for so they can reach out and have maybe little things fixed so that they can work on the big things?
Well, I I would say that definitely what you just alluded to is that yes, there should be somebody who likes to cook. Not everybody is a fan of cooking, so there should be somebody who's cooking. But I do want to stress, there should be someone who is the emotional aspect. I remember when um caregiving for my aunt, it was a family shared experience. However, there were only certain people where she felt emotionally available to. Like when she had ended where she didn't want to continue with chemotherapy or radiation, she told only a select few that says, I don't want to continue on with this. I'm ready to just be done. And not all caregivers can handle that,
Yeah,
because
that.
some caregivers will be like, no, what are you talking about? We're keeping this going, and so that alludes to the point where there should be an emotional buddy that you can talk to. And I want to stress that, especially for caregivers in our society, in our climate, who also may be working several other jobs as well. This is important to realize that we have a lot of caregivers who are working outside of the home, have full-time jobs, have children, and so it can be burdensome. And so there should be someone that you have, someone that you could say, I'm tired. I don't know if I want to do this anymore. And you may not mean it, but sometimes it's just good to relieve that stress. Sometimes we find that in other forms, such as journaling, maybe drawing. But, in terms of tools, I do think that it's important to um, probably do a planning session where you list out all of the key responsibilities that you need, such as medication, things like that, and try to involve other people that are good for it. I always stress that even as a nurse, I'm like, it's important to look at what medication you're putting out, because if you're doing it late at night, you might make a mistake. So, is there somebody who you trust, or is there a routine that you would like to put on the board or on the fridge in which you're like, okay, at this day, at this time, we're doing this? And this also helps the care recipient or your loved one too, in order to have that routine on what's going on.
That's so important. I wanted to add, because sometimes the caregiver is also can be an elderly person needing caregiving themselves. And I've seen that happen. Um, and so, actually, I know I'm a guest, not the host, but I have a question in the sense of how do we help navigate our community, especially that is so medically vulnerable, so medically underserved, to navigate the system to get the kinds of social services support and the medical assistance support that they need, especially when both parties may be elderly and the caregiver is also elderly. I think we struggle with that because we don't get care even when we're fairly well. And we definitely don't get good care and good support. And how do we navigate the system, the social service system, Social Security, all of these systems that's supposed to be there for us? How do we navigate those to get the support that we need, the
I
financial support, medical assistance, all of that?
I still take the position that education is what's the key to things. We don't know, and but in this day and time, we have so much access to resources that we do not utilize. It's not too many things that you can't go online and read about to know what's going on, and to get people to advocate in groups. People respond to numbers. When you show that it's a bunch of people who want to know this information, somebody's going to bring it to the table. We don't hold people responsible the way that we should when it comes to things that we have the right to. The the health industry is nothing that I'm saying right bad about them. They just their business. They take care of business. They're not doing the physical, the emotional side of that, and they're really not doing the educational part on the social end of the medicine. Their job is to find out what's wrong with you and do something, whether that's operation, whether that's medication, or changing your diet or something like that. But they do not invest the time to educate people on what to do. I remember my mother died of cancer, and they told us that she had 2 weeks to live. That's what they told us. They sent us home with no instructions, nothing what to do. And when she ended up coming back to the hospital to get the final diagnosis from the oncologist, she was wheezing and carrying on, and I took her to the emergency room, and it turned out she had pneumonia. And the nurse that was on duty, she said, "Did they tell you what to do from this point on?" I told her, "No, nobody said anything." She took the time to explain to me what stages my mother was going to go through, what to look for. Don't force feed her. Don't call 911 to bring her back, and different other things that I did not know. So when I saw my mother died 5 weeks to the day that they told us that she was terminal, I saw the change in her as just like what that nurse told me was going to happen. And my sister tried to force feed her, and I told her what the nurse had told me not to do that. I'm saying things like that. You just go send somebody home with somebody that's dying and you didn't give any kind of instruction. And then, this is the emotional side. This is mama you talking about. Mama. And you're going to send me home with mama and the rest of us, and we don't know what we're doing. So I'm just saying all that to say that I think that if we can find more ways to educate people and get that message out, and it has to be people of influence that get that message out to them and bring it on home, I think that things would be a little bit better. And it would also put the health industry on notice that we know what needs to be done. Now let's get it on.
And in fact, we offer a lot of information all the time. That is a big passion of ours, the four of us. Um, However, Dr. Kimlin was asking the question about our elderly and how do we get the resources to them as well. I know people that are 50 years old that still don't touch a internet.
That's true.
That blows me away because my mother, who is that much older than me, she navigates quite well. So one of the things I would ask is, again, how do we get to the elderly? And I can remember when I was diagnosed, and the doctor, my oncologist, she went down a long list of different things that I could think about, I can anticipate, how to plan. So I had a good oncologist who was patient with me. But it was amazing because when I got home, she called. Of course, I wanted to go into panic a little bit, but she said, "Oh my goodness, I just realized you're my youngest patient. You're only 40. Have you ever thought about having children? Because if you do, then we need to have another conversation in here, about that." And I said, "Well, okay, so I'm glad that she thought about that." But when we look at the doctors who are seeing patients every day, and I know how it is when I'm interviewing and I'm having to share the same kinds of information all day long. I think I told you, but I really told someone else. So, there should be a checklist, to help us navigate through answering the questions or sharing the information with individuals. However, one would think that the next person in line would either be the advice nurse or the social worker who is able to provide additional resource. Because I know, because I'm a Kaiser patient, they actually handed me a packet of brochures, resources, and information that says, "We don't know at what point you might need this or you might be interested in this, but here's some information." Because there's no way that we can tell everybody everything to expect or anticipate.
I
Pastor Ron, oh,
go ahead, Dr. Ashing.
well, it brought up two issues. One is the digital divide and how do we get our community acclimated to reality, right? Computers and technology is the way we're going to deliver lots of care, including telehealth and telemedicine. Um, and along that line is, cancer is such a complex illness. So if we're talking about caregiving, especially in the cancer arena, um, it would be important to have part of your caregiver team. So really, people need a caregiver team, that someone who is an advocate in the medical health space, because cancer care is delivered very differently depending on your coverage, depending on the questions you ask, depending on who you take with you to the appointment, depending on how activated you are, depending how much you are engaged in your own treatment decision making. And so your caregiver or team of caregivers would be important to include someone who could be a medical advocate as well, who would be educating, as Dr. Jenkins keep talking about education, educating you, the patient, but educating the family and the caregivers, along the lines of your treatment decision making, along the lines of your follow-up care, what type of surveillance and follow-up care that you need, what are some of the side effects of the treatment, and how do you manage those side effects, and not thinking that it's the cancer coming back or something like that, which could be very scary. So because it's so complex, a team caregiver approach is important, and having someone on, and it could be someone from a support group who's been through the experience and have the real life experience of what cancer treatment could be like and what kinds of treatments are available, to give you that guidance along those lines, as well as how to manage the symptoms, because cancer comes with specific symptoms, but the treatments have their own symptoms as well.
And I think, to add to that, that's a wonderful resource and tool, is to have a caregiving group, a caregiving team. One of the things recently, one of my family members went through um, a longer illness trajectory, and I was the one who would read the notes, the medical care notes, the physician notes, and be able to interpret it for the family, to say, this is what the CT is saying, the differential diagnoses. Um,
What's a CT?
oh, so your different scans, your so all those different scans, your MRI, all those, and that's where the health care professional comes in is to say, you know, these are the type of tests you're going to go through. Do you have to do a repeat colonoscopy? How will that go, you know, within the 6 months? And so this is where the healthcare professional. So I think having that team is important. And I think that social advocate is so important. To bring up to Dr. Ashing's point, and as well as Pastor Rhonda, as well as Dr. Jenkins, education is key, but reaching out. It's okay to, as I say, it's okay to be a bug. You know, you are in need of the resources, and sometimes it's beyond our fingertips. And so you have to ask. If you have a church family, say, you know, have you went through this? We're talking about elderly. So sometimes in the past, we've brought in the Department of Aging for Los Angeles County to come and provide resources such as meals, transportation. These are different things that we have injected, because sometimes it may not come from the chronic disease itself, such as if you're battling cancer, but it could come from other departments, especially at the county level, the state level. So sometimes I'm always advocating for people to check out like in-home support and, you know, IHSS. You might be able to get one of your loved ones in order, or someone you know, to help with the caregiving and to be able to get compensated for that. So it's just asking around. If you're not on the digital spectrum, you know, out, because I do say YouTube. I'm like, if you don't know how to put a bedpan on someone, YouTube it. They'll show you how to position. But if you don't know, then ask. It's nothing. The worst somebody could tell you is no, I don't know. So always feel free to ask, and let it be known on what you may really need.
And they still have cell phones. Even 50-year-olds have cell phones, so they can actually get on there and call somebody. So it's not like they don't have a resource at all. That's technology. But the other thing that I find too, I'm a 12-year ovarian cancer survivor. And what I do find too, a lot of times that I think a lot of misunderstanding, that people think when you had chemo and you're through with the treatments that this thing is over. It's a wrap. You know, you well now. No, it's an ongoing, continuous journey, because you want to make sure it doesn't come back. You don't make sure you know, whatever it was that caused it, from stress to your poor diet to whatever it is, you want to try to work on those things to do. It's been 12 years for me, and my body still has not responded to what it used to, and it's not going to. And it took me a long time to understand that it's not going to be the same, but I'm still here. And my diagnosis wasn't like other people where they might have felt a lump or something happened. They gave me an MRI, a full body one, by mistake. I wasn't supposed to have it. It was supposed to be waist up. And I get a call on my job telling me I need to see an oncologist. For what? I pointed up here. I said it was up here. It wasn't down there. And they told me I needed to go. And that's when I found out what I had. You see what I mean? Well, God was in that one. So, but when I think back on some things, the signs were there. I just didn't pay attention to the signs. They were subtle, but they were there. You see what I mean? But I'm saying that I think we got to get past that. Once a person has chemo and they're finished with their chemo, that this thing is a wrap. It's not.
I know that to be true.
Yes.
I truly know that to be true.
Yes.
Some of the side effects that we have are lifelong. They're chronic. Lymphedema being one. Sometimes neuropathy is another. Part of this is education. Lymphedema, the swelling of a limb as a result of removing the lymph nodes. It could be a leg or an arm. It could be other parts, but those would be the most obvious. And an individual that has experienced lymphedema, they have a hard time buying clothes. A very hard time buying clothes. And I'm one of them. You know, you can see I'm almost always sleeveless. You cannot tell the weather by my attire. You know, and then what is it? Neuropathy. the tingling of the hands, the numbness of the fingers or the feet. It gets some people I know, they have challenges walking, but that's not something that you can see until they start walking.
My sister
So
is going through that right now. Her hands and her feet. She sometimes she can't feel either one.
so how can you drive? How can you hold a glass?
Right.
You never know what's going to happen when. You think you're holding that glass nice and firm, and then all of a sudden it's on the floor. So, so there are a lot of side effects that come. The journey is not over with the finish of treatment. In fact, I don't want to talk about it here today, but it's for another show. There's a conversation about the relationship of heart disease and chemotherapy. It's another side effect, so a number of things happen, but I'm with Kathye. I'm still here. I'm still here. Amen. So another question, what can the caregiver do to for self-care? What can they do? What should they do?
I think the one thing everyone knows about me, I always say, and that's why Pastor Rhonda started laughing, are you getting enough sleep? One of the sleep is so important. I remember I will preface this story and then I will get into just a little bit. I remember one time I was at a conference and I was listening to this individual give a testimony about her husband who had recently passed away, and she was a caregiver for many years. And she said she could hardly sleep through the night because she was just always up wondering, would he need something, or where he have some type of symptom or an emergent action would be needed in the night, such as if he had a heart attack or something. And so with that, she noticed that she started to not sleep during the night. And so it became where she developed insomnia, and now she had to now needed a caregiver because now she was suffering with the stressors and chronic disease from being a caregiver. And I'm prefacing that because I say a lot of times as a caregiver, we don't take care of ourselves. Wellness is not utmost for us. And so we start to, our nutrition habits, our sleep, our patterns, everything starts to become wayward. And so what I've actually examined from a lot of our studies is that a lot of individuals, their healthcare problems either develop or worsen through their time as being a caregiver. And so this is why it's so important that you start to take care of yourself, whether it's taking, I always say, at least 15 minutes should be taken out in the morning and in the evening just for yourself. Longer, but at least 15 minutes to say, hey, can you take care of my loved one? Will I just walk outside for 15 minutes or such? And then making sure that you're getting sleep. Whether it's sometimes, please make sure individuals are getting sleep. And so I'll leave it there and then allow my other co-panelists to speak as well.
Girl, you said it all. I mean, really, it's about taking care of yourself as best as you can, given that caregiving is a labor of love always. But remember that, if your primary purpose and role you think is to caregive, then in order for you to be best at that role, you have to be caring for yourself too. So sleep, trying to eat as healthy as possible, avoiding a lot of, animal products, eating more plant-based food, taking care of hydration. That's another thing that we forget. And when I say hydration, I don't mean sodas. I mean water. We gotta drink water.
How are you feeling now, sister girl?
Yes. And
what about that stuff that's good for the blood?
A little wine.
A little red wine.
A little red wine.
But that's gonna deplete your
wine is actually, alcohol is actually dehydrating. but a little red wine is fine.
Mhm.
As my mother always say, too much of one thing is good for nothing. So the recommendation is, if you're a woman and you drink no more than 2 glasses a day, um, for eating animal products, if you are not vegetarian or vegan, it's 3 times a week, not 3 times a day, for breakfast, lunch, and dinner. Hydration, hydration. You want to drink over the course of the day. Start your morning with some hot tea, some hot water, uh, before you eat anything, to just get your system going, because your day is demanding as a caregiver. So really taking care of yourself, remembering to reach out to your friends and family for support, as we kept saying over and over and over. We need to call someone, as Dr. Jenkins says, you have a phone, even if you're not on the internet, call someone. Go out from time to time, put on, some, you know, new clothes, put on your shoes, take care of yourself a little bit, to give yourself um, a sense of me. And that's not being selfish. It's really about loving yourself too as you do this, because we want the caregiver to feel valued in and of themselves, because um, unfortunately, resentment could set in, because it is labor of love. So you've got to do a little bit for yourself every day, as Dr. Cobb said, but a special time to take care, even if it's once a week, just to go out for a walk, call a friend, go out to lunch, of course, with COVID safety in place always. But do something that honors your body as well, and honor your well-being, honor your spirit.
And adding to that as well, we can't be too sensitive as a caregiver about a person's reaction to a diagnosis that they have received. You have cancer. That person now has been traumatized to a point, because sometimes when we think and hear a diagnosis of cancer, the first thing we think is we're going to die right away, like it's a terminal thing. Not all cancer is a terminal illness, a terminal death sentence. And so, but this person has been traumatized, and sometimes they lash out at the people that's trying to help them. They do that. They lash out because they're hurt, they're angry, and they have nobody else ready to turn that anger and stuff on except the person, so a lot of times, that's closest to them. So in that respect, you have to be a little bit more sensitive and think about, if you were in that person's shoes, how would you feel knowing that you have cancer? Knowing that you're going to have to go through the unknown with treatments and surgery and things like that. Plus, what I think is also good, those of us that know people who are caregivers, every now and then send them a little something, something. And we're not talking about always money. It's not always money. I have books, I go on Amazon, like word search books, and depending on the age of the people, I make sure it's large print, because I'm in the large print category now. And I'll send them a little book. Like, I've been sending coloring books. They even have a coloring book for cancer with scriptures in it for cancer patients. But I send it to the caregiver too, as a little something, something, as an encouragement. They didn't know it was coming. And when they get it, they can't believe that somebody actually thought about them versus the person they were taking care of. Now, I'm not saying that for whatever. I'm saying that we all can do something. We all know somebody who's taking care of somebody. And it's not the big things. It's the idea that you even thought of this person, to send that as an encouragement. And it does help. It does help.
And
Mhm.
can I add one more thing? I think I want to just add on everything Dr. Ashing, Dr. Jenkins said is amazing. And sometimes I don't want to, sometimes I'm cautious about saying this, but because I've seen it at various levels, for those who have highly administrative jobs, to those who might be in the home doing solely caregiving. One of the things that I've noticed is, especially among female caregivers and males too, I should say, is having depressive symptoms and depression. And, it's important, especially to be able to be assess yourself. It's okay to log onto the internet and say, I'm gonna take a little depression test and see how how many depressive symptoms that I have. And I say this because I've seen where a lot of caregivers go throughout life. They're doing the routine tasks, they're taking on so much stuff, and they haven't truly assessed to say, am I am I having issues with getting out of the bed daily? Am I not eating? Am I drinking too much with caregiving? And so this is the reason why I always urge caregivers. I'm like, every 2-3 months, check in with yourself. Do a depression screening test, and just to see how are you coping, how are you dealing. And so that's one of the tools I would definitely urge with, because this is something I've seen increase, especially with COVID-19, with everyone being in isolation. This is something that is increasing and something we have to pay attention to.
I wanted to add a resource to that. So that is so important, Dr. Cobb, to check in. And sometimes in our community, in our culture, we think feeling down or being depressed is stigmatized. But it's not. It's very common. And given the situation, sometimes it is, situational, given that you're doing caregiving and life is particularly demanding. But, support and therapy, including medication at time for depression, can help tremendously. And one of the resource in terms of a self-assessment is a collaboration between Anthem and Pfizer and City of Hope, um, the um, the National Medical Association, and it's Take Action for Health. So takeactionforhealth.org, and we have a emotional well-being screener, and a wonderful program developed by a colleague of mine, Dr. Marva Lewis, called the Ubuntu program. And so it's a community-driven program. It's um, targeted for our community. It's Afrocentric. It's looking at values that are culturally consistent for us. And so it's a program that's within the Take Action for Health, and there's no charge. Again, you have to get on your computer, but it's also available on your phone. So any kind of device, takeactionforhealth.org.
Well, Dr. Kimlin, while we have you there, you mentioned the water earlier, and there was a question about what about 16 ounces of room temperature water in the morning?
Yes. So I mentioned hot because that's my preference, to start with hot water. That's, better, but any kind of water that you prefer. So it's any kind of water, as long as it's not, fruit infused or so, and it could be filtered. So I drink water, right off the tap that's filtered, because I'm also an environmentalist and I want to reduce the plastics. Plus, these plastics also leak. So hydrate yourself, but be kind to the environment as well.
And then someone asked the question, Brenda asked the question, said, awesome information. We need to care for ourselves too as caregivers. So we talked about exercise. No, we didn't talk about exercise. We talked about sleep.
Yes.
We talked about drinking water. We mentioned nutrition, and the other would be exercise.
Definitely.
But as we talk about those four things, we mentioned them. People are always asking that question: how much more do I need to do? Am I required to do 64 ounces of water a day? No, depending on who you are, on all of those, you need to ask your doctor. find out what's best for you. But in any case, I think I have an answer that would fit everyone. Everyone, rarely can you say everyone, but I think this is a good one for everyone. When you want to know how much more or how much better should you do tomorrow, and the answer is more than you did today. So if each of us begins to focus on being better, and I like to say choose life. When we're choosing life when we eat better, we're choosing life when we exercise, we're choosing life when we put a plan together to consume the amount of water that we should be consuming. When we talk about how much exercise we should do, we're choosing life. Because if we weren't trying to live better, live longer, then we wouldn't be working on those things. So I hope no one has to put a band-aid on after hearing that comment, because that might be a little ouch. But as we wrap up our conversation today, I'm going to allow our panelists to share one thing that they would really like to drive home in regards to caregivers. But I want to say a word to the cancer patient. Those people in your circle want to contribute to your healing. And each person, which ends up being your caregiver, you might just say that there's someone who just passed by. You might say they're a coworker. You might say they're just a neighbor or a family member or whatever. But whoever these people are, they are looking to you to help them a little bit. So like we mentioned earlier, if you know somebody really likes to do, shopping, grocery shopping, then let them handle that. And that's one thing they could do once a week or once every, and, when you're not feeling well, shopping may not be as big as it was when you were okay, but give out assignments. Somebody might love to clean house. Let them come and make sure your bathroom is clean every day or every once a week. Come up with assignments like that so that your village, and you'll begin to find out who they are. Your village will be able to help you. And when you give someone an assignment that's something that they already enjoy doing, they won't complain so much. So we're going to take it from the top, Dr. Kimlin. Is there anything you'd like to say before we go?
I'd like to, have the caregiver keep in mind that they are only human, that it's a labor of love, that it's okay to feel down sometimes, that that's normal. It's you might feel guilty when you feel frustrated. That is normal as well. I think being gentle with yourself is so important. And if you're a spiritual person, that could be a huge, huge resource and comfort to you. So, reach out to the Lord, reach out to God if that's a belief that you have. Faith based support can be very healing and therapeutic, not just for yourself, but for your family. Prayer does work. So,
Amen.
thank you, Dr.
Amen. I won't be a doctor yet.
Yes. Well, you're honorary. You have an honorary doctorate. We know that you've been working at this for 20 years, and you have used your cancer patient status to be an advocate, a survivor, and a thriver. So your honorary doctorate is well deserved.
Amen. Thank you so much. Dr. Kathye?
I keep calling you that, so maybe we're going to speak that into existence. Who knows?
Who knows?
Those of you that are caregivers, I would say don't let the one you're taking care of kind of guilt you into things, because a lot of times they don't want anybody else to help. They just want you. You can't. And what happens if something happened to you? Somebody gonna be taking care of them. So don't let the guilt get to you. You're doing the best you can, but you're not Superman or Superwoman. We all have our limits, and especially when you pass 50. Those of you that haven't got there yet, you just keep living. When you pass 50, Sister Cobb. And see, you haven't got there yet, but you'll see what I mean. That it does make a difference with getting some help. And there's nothing wrong if the person said they don't want to help you or can't help you. You just keep going till you find that person that's going to be there for you and help you. Also, when it comes to the mental health aspect of things, read your Bible. There are a lot of instances in there where people suffer from depression and whatever because of circumstances that was just a bit much for them. So look at that too. And it's not a sin to be depressed. But the sin, if you want to call it a sin is when you don't do anything about it to make yourself better because God didn't create us to be in that fix. And the last thing I want to say, the Bible does mention about women drinking wine. It said not giving too much wine. So that didn't mean we can't drink it. It said not giving too much wine. I think that Paul said that, not giving too much wine. Okay.
When we say one glass, we don't mean the one this size.
Yeah, that's right. And thank you, Pastor Rhonda, for this time and opportunity. And one more thing I'm going to go on. Those that are listening, this is where we're talking about is share what you have learned today. Share that we have these programs and outreaches available. And that's something that we will not do. I don't know why. Is that we will not tell other people about what we're doing, what's going on. This is free. It's not, it didn't cost you a thing to come here. So take advantage of these resources that's being put out there by people like us that's doing the best we can with what we have. Thank you.
Awesome.
I want to echo everything that has been stated already, and I think it's important that as caregivers, you acknowledge your role. You wear that badge with pride. You know, we focus on promotions at work and if we get an award and a recognition, but being a caregiver is what we say, a labor of love. And you need to acknowledge that with pride, wear it because you're caring for someone. You're that lifeline for somebody, and so it's important to recognize that. And I think what's been stated here is to also know, ask for help, just like everyone who's watching this, just like when you go to different conferences, put in the chat, how do I get more resources? Where do I turn to? What was that program you mentioned? And even when you're at church, a lot of times we as caregivers, we stay within the family unit or we stay within ourselves and we don't bridge out and ask. And especially due to COVID-19 now, we've become even more isolative that now we're just staying in our lane, and probably because of COVID-19 measures. But then I say expand those resources. If you don't like YouTube, if you don't like Google, call somebody up, join the chat forum. Just like Celebrate Life Cancer Ministry has tons of resources, join a support group. You will learn so much from that. And so that's what I would impart to everybody here today as a caregiver, is to please exercise your resources. Don't be fearful to ask around and join in things. Don't join in so much where you overburden yourself even more, but feel free to join in some things because it can be therapeutic also for your own wellness. So I would leave with that and wear your badge. Caregiver badge.
This is wonderful. I wanted to add to that some resources that's available. So the Black Psychologists Association has resources on emotional well-being that's targeted and tailored for our community. The Black Social Workers Association also has resources. So as Dr. Jenkins said, there's no sin in needing emotional support and well-being for the caregivers. So reach out for those support, reach out with your own network, your own family, but also professional help is very much available and effective.
Amen. Amen. Thank you all so very much for coming on the show today and talking about supporting caregivers. But there's one person we did not talk about, and it's the person who sees somebody needs help. And I would just encourage, if you see somebody needs help and you have a solution, don't sit there. Offer them the support that they need. And that might be your whole role in the healing of that person, just to be able to provide that support and filling in a gap where, don't wait for them to ask you. If you see the need is there, go ahead and fill the gap and be a blessing to someone. So Dr. Ashing, Dr. Kathye, Dr. Sharon, thank you so much for coming on. You have truly been a blessing to many. We have a couple of comments over there. Folks are pretty happy about having sharing this time with us. But as Celebrate Life Cancer Ministry, we are here to provide support to individuals and their families who have been touched by cancer. And that's everything from outreach, getting screened, to walking through the journey with you, treatment buddies, telephone buddies, hospice support. We have monthly support group meetings, and we have this talk show, Celebrate Life Today with Pastor Rhonda. And I thank you so much for joining us. And until next time, choose life.